Hi there, my name is Rebecca Lantry, and I currently live in San Diego, California. I'm originally from Los Angeles, California, and I've been living here in San Diego for about 4 years now. What brings me to this class and this program is my ultimate career goal. I would like to work with youth, specifically who have experienced trauma, using expressive arts and counseling techniques. So this course material and this course specifically interests me so much. So I'm really excited to continue to engage with the readings and with all of you as we go back and forth commenting on, on one another's videos. So thank you for tuning in. My biggest findings and things that I've learned from this reading were mainly based off of the historical viewing of trauma and how it was related to behavior, and specifically from the path from hysteria to trauma and how we got there. And what shocked me the most were the lulls in findings. For example, when Freud discovered that hysteria was actually caused by traumatic instances happening to these victims, and chose not to go publicly with it. It was because he didn't want to accept, he couldn't fathom that this behavior, these traumatic instances happening to these women, it was a pandemic. It was happening systematically, and when you accept that, you have to you have to take on social responsibility, and that was something that Freud was just not willing to do, according to the text, and that just shocked me because if you think about, had this been named, back in the 19th century, how far could we be here now? And so something that really struck with me was historically the fact that trauma was only really recognized not as a moral issue, but, as something that's a reaction, that trauma caused behavior in people, and this behavior is a reaction to those traumatic events, and that these people, these victims of trauma, are just trying to get back to normal, get back to their equilibrium. And the fact that this didn't really become publicly recognized officially until the early 1970s really struck a chord with me. That seems so late. And the fact that these, veterans groups and the feminist groups brought attention to it is wonderful. It just seems a little bit late to me for some reason, going from that shift. I mean, that's my generation of people, or the generation before me, rather. And so I feel fortunate to be, in something that's relatively new, and also bringing light this kind of social responsibility that comes with being informed about this trauma. And on that note, my understanding of trauma-informed care and the language and positionality is that someone who's informed by trauma, right, and practices trauma-informed care is compassionate, is empathetic, and really focuses on the individual and getting them back to normal, with them being in control, them steering the wheel, and as an old colleague of mine used to say, kind of being the guide on the side to get them there. That said, having consistency with that person is really important, and that understanding that it's not a pathology or a moral issue, as it says in the text, but rather these behaviors are reactions to get back to equilibrium. So thank you so much, and I look forward to engaging with you soon.